Welcome to the MS Path to Care webinar series. The topic of our first webinar is Mood and Movement, what we know, what you can do, and who can help. This is part one. My name is Mandy Rohrig. I am a physical therapist with CanDo Multiple Sclerosis.
And I'm Roz Kalb. I'm a clinical psychologist with CanDo Multiple Sclerosis.
Today, we're going to talk about the following objectives. We will discuss understanding the impact of mood on exercise and exercise on mood. We hope you will learn the red flags for important mood changes, recognize any emotional barriers to trying new activities or trying new ways to do old activities. We will also discuss options for staying active independently and with others. We will talk about possible approaches for motivating yourself and others and brainstorm some important conversation starters. So let's get started. Roz,
Thanks,
what do we
Mandy.
know about mood changes in MS?
Well, I think that this is really an important topic for people to understand because mood changes are so common in MS. More than 50% of people who live with MS experience significant depression at some point along their disease course, and anxiety is at least as common. In MS, depression and some other mood changes are actually hardwired into the disease. They are symptoms of MS, just like any other symptoms a person might experience. And they're caused by neurologic changes as well as changes in the immune system. And of course, the psychosocial challenges that people face when they live with a chronic illness. The important thing about depression is that it makes other symptoms feel worse. When people are depressed, their fatigue feels more fatiguing, their pain is more intense, and their cognition may be slowed. We also know that people who are depressed or very anxious or moody can have difficulty taking care of themselves and taking care of other people. They may have difficulty motivating themselves to stay active, which is why we're spending time talking about mood and physical activity and exercise today. They may lose time from work. They may be very irritable, and that makes them sometimes pretty difficult to live with. We also want to emphasize that support partners can also be at risk for significant mood issues, but for different reasons. Obviously, it's not hardwired into anything, but they may also have pretty intense anxiety or depression. So it's important for people to know the symptoms of depression so that they can recognize them more easily. The first two are sort of the cardinal symptoms, and one should pay attention. If they're sad or irritable most of every day for several days in a row, that may be a strong indicator of depression. If someone has lost interest or pleasure in everyday activities that used to give them pleasure, they just can't engage in anything or care about anything. The next four are highlighted in blue because they are so easily confused with symptoms of MS, which makes depression sometimes more challenging to diagnose in a person who has MS. But they may experience significant changes in appetite and weight, either way up or way down, sleep disturbances, either not being able to sleep or sleeping too much, fatigue, the feeling of just feeling exhausted, which of course we know is also common in MS, and problems with thinking or concentration. People who are depressed also can behave in an agitated way, or they can seem very slowed in their behavior. Feelings of worthlessness or guilt are also common, as are persistent thoughts of death or suicide. So these are all symptoms to be on the lookout for.
So I think it's important, Roz, before we talk about the impact that exercise and physical activity can have on mood issues, it's important to kind of define what exercise and physical activity are. So exercise is a very structured form of physical activity. So it's usually repeated There's a pattern to it, and it's done consistently over a period of time. And there's typically a general objective or a goal that you're trying to achieve, whether it's fitness or health or some type of performance objective. Now, exercise falls under the umbrella of physical activity. And physical activity is any and all movement that you do over the course of a day. So it can include folding laundry, it can include doing any other household chores, but it also includes that more structured exercise program that you might be participating in. But overall, the recommendation by the National MS Society's work group is to try to achieve 150 minutes of moderate intensity exercise or physical activity every week. Now you might be thinking, whoa, 150 minutes. 150 minutes, again, is spread over the course of the full week, and any and all movement counts. So it may be 5 minutes here, 2 minutes here, 3 minutes here over the course of a day, but all of that adds up to that 150-minute goal. I should also add, if 150 feels very unachievable, starting at a lower amount is something that we often encourage people to strive for, and then gradually working up to that recommended amount. So here are some examples of people participating in different types of formal exercise and also in physical activity. So the gal on the exercise bike, she looks like she's chatting and enjoying herself. Very structured, formal form of exercise, similar to the gal in the lower right-hand corner. The upper right-hand corner, the couple participating in partner dancing, that's a form of leisure physical activity, but also has some good research to support in the world of MS the value of partner dancing for people living with MS, not only on their mood, but also on their fitness levels. So maybe something to consider exploring. So what does the research suggest about the relationship between mood and exercise in the general population? Let's start here. So we know that research suggests that physical activity and exercise releases those feel-good hormones, those feel-good chemicals, those endorphins that make you feel, wow, I feel really great after I finish that exercise routine. There's also some evidence to suggest that aerobic exercise in particular may be just as effective as antidepressants for managing mild to moderate depression. So that's kind of encouraging if exercise and antidepressants or medications could have a similar impact. And lastly, but certainly not least, that regular aerobic exercise, or that exercise that gets your heart and lungs going, can decrease stress, can improve mood, and certainly improve self-esteem. So this is what we know in the general population. And some of this does in fact translate into folks living with MS as well. So what do we know about mood and exercise, the relationship for people with MS? The current research suggests that exercise, when you try to achieve those recommended 150 minutes, they can in fact improve depressive symptoms. Exercise can also have a strong impact on people with chronic brain diseases, including multiple sclerosis, as well as Alzheimer's disease, among many others. So again, exercise, not just for the muscles, it can be for our entire body. We do know there is some evidence to suggest that even single sessions and short bouts of exercise, or even yoga, walking, things like that, can improve mood symptoms. So again, it's just the idea of trying something, doing something even for a short while can have a really positive and profound impact on how you feel. And this is an interesting one to me, that even talking about strategies to increase physical activity can have a positive impact on mood symptoms. So talking with your physical therapist or talking with a rehabilitation professional or physical trainer about strategies to improve exercise and physical activity can have a positive impact on how you feel. Very exciting. Simply talking about it is a good way to start. And lastly, we know that teens can be impacted. Teens with multiple sclerosis in particular can benefit from participating in moderate and vigorous levels of physical activity. So all impactful, all positive. There's certainly no harm in trying some exercise and movement.
So why are we talking so much about mood? Well, we know that people's moods can really impact their motivation to exercise, right? So we want to understand how we can improve mood so that people have an easier time meeting their exercise goals. When folks are depressed or anxious, all of us, we feel less motivated. We feel less energized because those mood changes weigh us down. They are heavy, uncomfortable feelings that make exercise seem just too difficult. When people are depressed and anxious, they also tend to be more apathetic about their health and well-being. They just don't care or can't get themselves to care. And they're less likely to engage in the community. So that means they're less likely to participate with others in any kinds of physical activity or the social activities that Mandy was talking about, like dancing. And as I mentioned before, depression can make other MS symptoms feel worse. And when those other MS symptoms are in the way, we feel more tired, more pain, just generally down. That makes it hard to be motivated to exercise. So what are some of the red flags that you want to pay attention to know if you're experiencing mood changes? So if we can go to the next slide, please. These are just things to be on the lookout for. Again, if you feel down or blue most days, every day for a few weeks at a time, that's definitely a red flag, as is feeling unmotivated or disinterested or disconnected for days at a time. Feeling exhausted and overwhelmed beyond the usual fatigue of MS. Just feeling irritable and prickly. We know that many people with MS who are depressed appear just very hypersensitive, prickly, and irritable. Sleeping too much or unable to fall asleep or stay asleep. Eating too much all the time or just having no interest in food. Feeling in despair. Feeling like things are just hopeless. If you're isolating yourself, COVID aside, where we've all had to isolate ourselves more than we wanted to, if you feel like you're just withdrawing from the world around you, that is a red flag. Or having thoughts of self-harm. So how do these mood changes get in the way of exercise? Well, here are some of the most common things that Mandy and I have heard over the years from people who are thinking about setting exercise goals, but run into difficulties. Well, if I can't do it the way I did before, I'm just not interested. If I can't be the tennis ace that I was, what's the fun? If I can't win, I don't want to try. And this is very important for people who have engaged in a lot of competitive sports, and it's the competition that has given them joy. They don't see any reason to exercise. I don't want to look disabled. I don't want people to look at me and feel bad for me or look like I'm not doing it as well as other people. I simply have too many other priorities in my day. I'm tired and there are too many demands. I just can't fit exercise into my day. We've heard that a lot, right? It all feels too hard. What if I fall? So worries about falling, getting injured, adding to the challenges of MS is something that makes some people hesitate. My family will be embarrassed. They won't like the way I look when I'm trying to be physically active. This is sometimes particularly true for teenagers or kids who don't like their parents to stand out or look different. Or my family is worried for my safety. So my family is discouraging me from being active because they think I'll get hurt. So we're going to talk in our next segment about some ways to overcome these barriers. But before I do that, is there anything, Mandy, that you would like to add to these barriers?
I was just going to add, Ross, if you feel this way, please don't feel ashamed, right? Like I think it's important to, if you feel this way, to try to use some of these strategies that we're going to talk about, and work through them, and recruit people to help you. Those skilled professionals can really help you figure out a way to work through these challenges. So
Great.